Falls are one of our biggest safety incidents within the trust.
If they can't see anyone and they think you're really busy, they'll think, I'll just have a go myself, and that's quite often when they fall. I'm really proud of the team. I know that they're empowered to try and promote patient safety.
Falls are a significant concern within the NHS, resulting in extended hospital stays for patients and affecting their health, confidence and independence. This week, we meet Paul Street, Falls Prevention Lead, to talk about the danger of falls and how they impact not just patients, but also place extra strain on hospital resources, as people who suffer preventable falls often need to be admitted. Paul also tells us what we've been doing here at the Trust to assess some of the issues that cause falls and what we've done to decrease them.
I'm the first falls lead that we've had at Bradford, and I review every fall that happens within the trust. So we look at the data and see where room for improvement needs to be made. Falls are one of our biggest safety incidents within the trust.
On Ward 31, we look after elderly patients. We know that the chance of delirium is really high, especially in this age group. Their risk of falling is really high. There was a patient who came back from theatre. She was so confused. In the end, she did fall. She had a fall alarm on. The staff heard the fall alarm and went to the room, which was the furthest side room at the bottom of the ward. On the face of it, you know, what could we have done differently? And that's where this all came from.
There are lots of different issues that can cause someone to fall. One of those is dizziness. We have urge incontinence. We have trip hazards. We have people that think they can just do it on their own. If they've had surgery, for example, they may feel that they can do what they did before they had surgery.
We have 13 side rooms, which is a massive number of side rooms. They're in there on their own. It's not just the staff that can't see the patients, but the patients don't see the staff. If they can't see anyone and they think you're really busy, they'll think, I'll just have a go myself, and that's quite often when they fall.
If you have a fall, that increases your length of stay. It also increases your risk of being deconditioned, which means that you're not able to get up and get out and be mobile again, which makes you more prone to falls.
Paul's been really supportive, providing insight into the data behind the falls, and having that detail helps you look at solutions to try and further reduce the risk.
Over the last 5 months, we've had a 5-month reduction in falls overall as a trust. That's because of the fact that we've been able to review every fall that's happened within the trust. It's about looking at putting in things to prevent them from happening in the future. It's looking at training and education for staff.
Hello everybody, my name is Paul Street and the lead for falls improvement at Bradford Teaching Hospitals. What we're going to talk about today is we're going to talk about frailty, we're going to talk about some falls and we're going to talk about reconditioning.
Recently we've started doing simulation training on the wards. The simulation training itself involves actors, and what the actors will do is they will be in a scenario, an award, and they will fall. What we are looking for is to make sure that they've identified the risk and that they deal with the fall appropriately.
So, falls intervention. In Bradford, we use a yellow wristband. So the yellow wristbands are put on someone if they're a falls risk.
One of the ways we can reduce falls is if we implemented bay tagging, which is where a member of staff is in a bay looking after 4 people to keep them as safe as possible. They then will switch over to make sure that the bay is not left unattended.
When patients are delirious and they come back from theatre, they become confused and distressed. So we use fall alarms. We invite families to stay to offer support and reassurance for the patient. It's improved the relationship and the trust between staff and relatives. We proactively risk assess daily.
The multifactorial risk assessment factors are line and standing blood pressure, making sure they've got a delirium screen, good footwear, making sure they've got a continence assessment, making sure they've got the falls assessment, the falls equipment, and making sure they've got a vision check.
We've worked with the falls prevention team to develop a role that's specifically supporting patients around falls prevention. The role of a volunteer on the actual ward will be interacting with patients. Games, puzzles, bingo, they can help with bedside tables, anything around supporting that patient that's in there. They're helping prevent anything further happening. We also volunteer to help release staff capacity. We've decided to replicate that role out to other wards across the trust as well.
Pre-COVID, we were having consistently 15 falls a month. I think one month we had 29 falls. Since implementing the changes, we have on average around 5 a month, so a massive improvement. I'm really proud now when I hear staff talking about where to place patients on the ward and what can we do about this problem. So I know that they're empowered to try and promote patient safety.
My hopes are that with all the multifactorial risk assessment that we do, it's helped to prevent people from falling over. We've really seen a better quality of nursing assessment, which is really good to see.
We have been nominated for a Patient Safety Award and we've been shortlisted. I'm really proud of the team. You know, you really want the team to want the best for the patients. And patients, they can see that staff genuinely care and we genuinely want the best for the patients. Once you start to see an improvement, it kind of gives them the motivation to keep going.